The health of Aboriginal Canadians has been compromised by a number of issues. One barrier is the difficulty they face keeping healthcare professionals in their communities and educating local ones. That shortage has meant that in many northern communities, pregnant women are flown south for 4 to 6 weeks to have their babies alone. No family, no community, and no one who understands their culture or their language.
Birth is a natural process, and Aboriginal people's view of that is that, it's an event that affects not just the individual, but family, clans, nations, and communities.
And when so many women have to leave their communities to have babies, that has a negative effect on the overall health status of these populations.
We know in Canadian society that communities that are cohesive on behalf of children make a big difference, and we also know that huge amounts of mobility and residential instability negatively affects their development. And therefore, midwife programs, if they're delivered effectively and allow children in northern and remote communities to be born in those communities, have the potential to strengthen community around children.
That's why Nunavut developed a new program in Rankin Inlet to train and educate local midwives. It's one part of the Closer to Home strategy to improve population health in the north. Rachel Jones and Diane Tic-Tac are students breaking new ground in their community. They are helping in the development of a unique curriculum that combines Western practice and Inuit traditions. The education is closer to home as well.
Why not do it in your home community, and your family can be there, your friends. You're not alone through that experience.
Your baby moving lots.
Need to educate the Inuit people to take on professional roles so that things like having to leave home to get health care can be prevented.
And this continuity of care is I think it would benefit a lot.
I have worked with over 50 different midwives. The turnover rate is very, very high, and that's why it's so very important for us to educate local people.
With BARP being around 20 weeks.
The course is designed to give adult learners the best chance to succeed. Students can exit the program, work for a while, and then return to school. At the end of the first year, they'll be certified maternity care workers, and at the end of the second phase, certified midwives. And the program has an optional year in partnership with the University of Manitoba for students to get their RN degree.
Training and education is really vital, and especially in the northern communities, is to train your own people to provide this service instead of sending them away to get their education and then not coming home. But it's so much nicer to have your own people looking after their own people.
So Brenda, how are you doing today?
And it's more equitable, critical to ensuring that our Native population has culturally sensitive care that's right for their community.
That's okay.
And we're looking at children getting a real head start in life, and there's also the parents who are involved in the process. So we're looking at this program really being able to impact the health status within 5 to 10 years.
The joy that is felt when a baby is born here, I cannot emphasize it enough. You cannot describe it. That kind of joy deserves to be shared by the families and the community.